So I think the first thing to realize is that there's a difference in the way we treat patients with Burkitt lymphoma depending on their age. So most of the time, this is a lymphoma that occurs in pediatrics, so patients under the age of 18. And those patients, most of the time, they're cured when you give them intensive chemotherapy. And what I mean by that is the cure rate can be as high as 90–95%. So they do very, very well. However, adults, patients over the age of 18, the outcomes aren't quite as good, in part because the treatment toxicity sort of limits the ability to give adequate amount of chemotherapy to them. So what you'll see in studies in adult patients with Burkitt lymphoma is it is common that they can't finish the chemotherapy, or the chemotherapy itself induces such toxicity that they die of that toxicity itself. So this has been a known problem in Burkitt lymphoma for many years. This problem came about because the treatments for all Burkitt lymphoma was derived from pediatric regimens. So essentially what happened, and this happened at our institution, in National Cancer Institute in the 1960s and 70s, is that what was effective in kids was then just taken to adult patients. And so children metabolize chemotherapy much more efficiently than adults, okay? And they're much less likely to have comorbid conditions that limit the delivery of chemo. So that's been a known problem, and when you really look at patients that get into the 40, 50, 60 range as far as age and older, they really don't have much chance of completing ALL type regimens. So people effectively use less doses or lower doses or less chemotherapy overall. And that's a problem because the dose intensity is probably the fundamental reason why most patients are actually cured.